So I've been to CMC a few times. By the way, your cafeteria is fabulous. And just beginning to get to know some of the people that work there. But you probably have some insight in terms of, what are the employees like at CMC, Monadnock, and Huggins Hospital that make GraniteOne what it is today?
Well, I think what I admire most about the employees at GraniteOne is that they have this sense of community. They really understand what they give to the community and what the community gives to the hospitals. And that formed the basis of a commonality that we found in our cultures as we've gone forward with GraniteOne Health. And it really started us on the right track as we went forward and integrated the three systems.
Do you know if a lot of your employees live locally, and at least taking the employees of CMC in Manchester?
They absolutely do. In fact, many employees will tell me that their father or their mother were born at Notre Dame Hospital or or they were born at CMC and so forth. So they take pride in the hospital itself and in the community.
Yeah, they're really a part of the community and working for the community.
Absolutely. I know Dartmouth-Hitchcock Health has 4 hospitals and a visiting nurse and hospice program, and so it may be more difficult to describe the employees' culture at each hospital, but can you describe the culture at Dartmouth-Hitchcock Health that your team has built as they integrated the systems?
One thing I noticed when I came to Dartmouth-Hitchcock and the other hospitals in our health system was that employees had gone through a little bit of a difficult time over the last 3 to 4 years. There were some financial instabilities, there were some reductions in force, and I would say that employees actually were not sure about the future when I went there. But what impressed me when I walked through the door was, in spite of all of the external things that could affect their attitude towards work, they had an unwavering commitment to great patient care. And we actually saw that in our engagement surveys, and I saw it when I actually would eat with employees in the cafeteria randomly at lunch, that they were there because they were 100% committed to the institution and to their patients. What's interesting is that the really sense of purpose that people have when they walk through the doors at both of our institutions is something that's actually really important for employees. And I think we see that and when they talk about what they value.
I'm always amazed at how they go above and beyond the call of duty. They don't stick to their job descriptions. They do things that I'm amazed, both inside the hospital and even after work in the community.
Somebody sent me an email just yesterday that she had observed a maintenance worker who saw a patient having a difficult time getting out of the men's room and back into his wheelchair, and stopped and helped him get settled and helped him on his way to his destination. It was great.
Those are the things that happen all the time that people don't realize, but it says a lot about our cultures.